Hi there again. This is Ruth Milky here, and I got to start off a little bit with your precepting training way before Module 1, and here I am again. And again, I am one of the Associate Deans in the School of Nursing, but more importantly, and germane to this topic, I have been and I get to be a preceptor, both for the Azusa Pacific University School of Nursing and actually have done it for a lot of other schools as well. So let's talk a little bit about one of the important aspects of precepting, which is effective feedback. So the feedback points that I want to preface this presentation with are first, that it occurs when outputs of a system are routed back as inputs as part of a chain of a cause and effect that forms a circuit or loop. And you're like going, well, this sounds like electrical engineering. Well, and indeed, the many of the origins of feedback actually do come from hard sciences like mechanical engineering, electrical engineering. You may remember in your pathophysiology courses that feedback loops are very much a part of endocrine system and many of the body's systems. Well, I want to convert this definition or description a little bit, and we're going to say occurs when outputs of a learner or student are routed back as inputs, and that would be to you as the preceptor, as part of a chain of cause and effect that forms a circuit or loop. It is the most influential and vital factor in student learning. We cannot do what we do in our classes without you. Feedback is ongoing as compared to evaluation. I want to differentiate these two a little bit. So feedback occurs real time while you're in the setting. There is a component that many of you may be involved with based on whatever you've been requested to do, and that may actually be student evaluation. Student evaluation is a formal assessment of students' progress, often compared to course standards. And you may be doing that at mid-semester. You may be doing that at the end of semester based on the use of a rubric or evaluation tool, and then reporting back to the course faculty. But again, we're talking about feedback today. And really it focuses on improving performance during the clinical placement. So let's move ahead now that we're all on the same page. So I'm going to talk a little bit about feedback. You're going to hear my perspective in my clinical life. I am a nurse midwife, a certified nurse midwife, and I'm also women's health NP. But more often, as a nurse midwife, I experience use of transfusion. So you think transfusion, what does that have to do with feedback and precepting? Well, precepting is the lifeblood of learning as a nurse. And let's talk about some of what I see as the connections between what happens during a transfusion and what happens in terms of precepting feedback. First of all, if a patient gets to the point where he or she, and in my case is typically a she, it's in the context of childbirth, gets to a point where we feel as a team, and again, as a midwife, as the doctor I'm working with, that a patient needs to get a blood transfusion, it's usually because we feel that that will save her life, will make her life, her quality of life better, will achieve those goals. So first of all, we offer this, and per the patient, it's either accepted or not. Okay, so that's really important when you think about our learners, is not only do we offer feedback, but whether or not it's accepted. Okay, let's talk about the timeliness of it. Of course, a blood transfusion is not going to do any good when there is, we're in such dire straits that getting it is maybe too late. So just think about that, because the most opportune time for feedback, if possible, is the closest to the event, because everything is fresh in the learner and in your mind. And then last, we can't give a blood transfusion if we don't have a match. We type in cross so that the lab can make sure that not only the blood type is correct, but also making sure that there aren't some crazy antibodies that need to be based, that indicate some kind of antigen that's there. So think about that. And as you work with your learner, you may have noticed various ways that the learner accepts your feedback better than others. Okay, so let's go on. Hopefully you'll think about this when you're in the clinical setting, maybe you actually when you're giving a blood transfusion, but probably more so, or I hope more so, ongoing as you provide feedback to your students. So let's talk about feedback models. And one of the readings that you did in this module was by Miller, Sawatsky, and Chernomus. And what they were doing is they wanted to develop a clinical preceptor training. So part of this article is what's called the review of the literature. And they basically look at different models of precepting feedback. And what you see here is a summary of the models that they look at or review in the review of literature. There are the first two that I'm going to focus on today. And then there are three more, and you see PEARLS, ARCH, and SPAR. And basically what those represent are acronyms that are, if you want to call, are prompts for you to think of as a preceptor in terms of how to provide feedback. You may recognize SPAR as being very familiar, especially those of you in hospitals, because it's really based on the SBAR acronym that we use to give report and communicate well in hospital situations. So let's look at the two that I've chosen, and probably because they resonate best with my style of precepting. And the point of being an effective preceptor in terms of giving feedback is not to do one size fits all, recognizing that many of you have had so many experiences of your own, either being precepted effectively or not, that you may decide that some of these fit you better than others. I have chosen the first two to talk a little bit because it seems to fit my style. Okay, so I'm going to talk about the feedback sandwich. And very similar or related is the Pendleton rules model. And again, the primary references for these two, if you want to call it approaches to feedback, are in the article that's in your module. So refer back to those. And if you do want to go to the primary resources, you can refer back to that article. So I want to point out a story that I think about every time I think of feedback. I've precepted again for a long time, and I've had the opportunity to precept for nursing students in undergrad clinical rotations in OB, and I've had the opportunity of precepting nurse practitioner, nurse midwife students in clinic settings and in labor and delivery and postpartum. And that's actually precepting them to see patients, to attend deliveries, do repairs, all the things that go with childbirth. But I've also gotten to precept non-nursing learners, specifically medical residents and medical students. And my point is that feedback is needed at all level of learning in the clinical scenarios that you're in. And I just will never forget that one of the medical residents that I precepted, it was a family medicine resident, I believe. And I attended a birth with her. And of course, we had talked through how she would approach that. I checked in on how much experience she had in and actually attending birth, and identifying that in my mind. I have expectations of how well she should be able to do certain things. And then after the birth, baby was out and on mom, and everybody was happy, and placenta came and all that good stuff. We looked for lacerations, made sure there wasn't excessive bleeding, excessive problems with the birth, and everything was fine. And we started doing some charting and some note review. And she looked at me and said, "So how did I do?" And at that moment, I thought, good for you. You actually asked what I didn't provide. And she wanted to get feedback. And as a very active learner herself, as adult learner, again, she wanted to know how she did. And that really brought home to me how important it is to provide feedback on a regular, ongoing cycle basis throughout the time we're with our learner. So let's now go back. Let's talk about the feedback sandwich. So the feedback sandwich makes it easier for the preceptor slash instructor to deliver and for the student to receive feedback. And basically the principle is that negative feedback, the part that a lot of us don't like to give, is sandwiched between two pieces of positive feedback. So there are some potential problems with this. And again, many of us don't like to provide this. It's hard, but it's necessary, right? The potential problems is that you may obscure the negative, the corrective feedback with too much positive. You may devalue the correction needed. And then to finish off, just really not taking enough time to plan for improvement. So I want those things to be in your mind as really talking about how do we apply, if you choose this model, as I use, to use this type of feedback sandwich or Pendleton rules model in how you apply or how you use feedback in the clinical setting. So let's go on, and we're going to look at the next slide. We're going to see the parts of a sandwich. So what is in my sandwich, or what is in the sandwich for this feedback episode? Okay, remembering that we're talking about an ongoing, maybe you just worked with a student, a nurse, to do a catheterization. Maybe it was to give meds. Maybe it was to choose whether or not to give the meds, to select the meds from the Pyxis, whatever it's called in whatever hospital you're in. So what is in your sandwich? Well, first of all, let's look at one of the pieces of bread, the top piece. Well, what was good? So, and that actually can be a kind of a bipartite part or a dyadic part of the interaction. Maybe it's a student that leads this. Maybe you lead it. So you may want to say, okay, we're coming out of the patient's room now. And again, I would have to say that a caveat is think about the best place to provide feedback. It may often be not in the patient's room, especially if there is the sandwich and we are going to be giving negative feedback. So that's going to be in a place that's private and non-threatening, and where the student feels that they're in a safe place to express whatever concerns or thoughts. Okay, so that being said, let's move on. What was good about that? And that you may ask the students, so what was good about what just happened? Or you may even want to be more general and say, what do you think? How did that go? Okay, your student, depending on various things, their communication style, their culture, how new they are in the clinical situation, how new they are to you, they may not say much. And that may be where you say, wow, well, I just wanted to give you a chance to reflect on that first. If you want me to, and my job is to reflect on how you're doing, these are the things that I saw. And that's where you may say, yeah, I really appreciate your level of concern with that patient, how you really approach the education on whatever you did in a way that they could understand it well. And then, so we have our top part of the bread or the sandwich. So let's talk about the innards or the negative part. So again, this is done by you. You're the preceptor. You are providing the corrective. You're changing the course. In other words, if that student does that again, because that's the only way he or she has done it, then that we haven't done our job, right? So to identify, I saw that. And again, I statements are typically less threatening. To say, I saw that, or I noticed that when you did X, Y, Z, you seemed to, or there was, or maybe I wondered what your thinking process was. That's another thing you could even ask. And it seemed like you were thinking that we are doing this because of this and not because of this. And in particular, when you're providing this, you may want to add some reference to, maybe it's a policy on the unit. Maybe it's something that you know that they've read in a text or have had to learn in a skills lab. So this really helps, because it's not just you're saying randomly, well, in my opinion, I just really don't like the way you did that. No, it's based on a standard, and that may be a safety standard, that what you were doing could have resulted in an adverse outcome or a problem for the patient. So then the other part of the sandwich, now that we've had those two pieces, now we're ready for our other piece of bread, and this is the plan for improvement. And again, I would encourage this to be a mutual exercise. So maybe you point that out to the students. So how do you think that, based on the feedback that we've looked at and what we've discussed, how do you think you will approach the next time you have that experience? And again, the student may give you a lot of good ideas. The student may not have that idea. They may be a little bit frozen. They may be a little bit kind of embarrassed. And so if they don't come up with that, then you can step in and say, well, these are some things I would recommend. And I do this sometimes. You may not want to. I even assign what I call clinical homework, and say to the student that, okay, by the next time I work with you, or even in the next hour of the day, if you have time to quickly review the steps for doing XYZ procedure, review the kinds of patient teaching that are necessary before going into surgery, or whatever it is. So that may be something you want to add as a plan for improvement. You may, as the preceptor, say to your student, I want to make sure that we try to do XYZ, that we give another med today together, so that we can use this feedback that you've received now as part of the next closed loop interaction that we have between you as a student learner and me as the preceptor, and see what improvement is made. And that is really effective, because if you can do that during the day of the same episode of primary feedback, that really has a great impact, and it's very great for the students' confidence. Okay. So those, again, that's just how I approach my sandwich, or how I do feedback. And I'm going to end this and just say again, thank you for sharing your expertise and your investment in the next generation of nurses. I know that it's not hard. It, in some ways, at least initially, can make your day seem longer, but hopefully after you invest with that student for several times, you have a little colleague, a little buddy that can actually help make the day go better, and gives you much gratification in terms of you're being able to show and share your expertise. We really can't do what we do without you. So again, we thank you, and we look forward to continuing to work with you. So again, a great nurse preceptor is impossible to forget. And I know that you're that person. So thank you again.